lifelong health begins when we're infants. And PGE recognizes the importance and value of supporting families in that choice. So they have incorporated it very clearly into their workplace culture. They've made a plan for how women can continue to breastfeed after they return to work. So PGE has a process whereby they have a stated lactation support policy in their employee handbook. So when an employee is expecting a child, they can talk with their human resources department about how to arrange for accommodation when she comes back to work.
My husband decided to stay home with my son 9 years ago rather than going into the workforce. So for me, working was critical.
One of the reasons I was very anxious about coming back to work was about breastfeeding, and I wasn't sure what the policy was at PGE. I also had a male supervisor and was kind of uncomfortable talking to him about pumping, but I did call him and we did discuss it, and he just informed me to contact the receptionist up in HR, and she would help me out with scheduling and show me the room and what options I had. The Healthy Family Room is a room they have up in HR that has a chair, outlets. They actually do have a hospital-grade pump for mothers who would like to use that pump. But you can just go in. There's a sign on the door that says it's occupied. You flip that, and you're able to lock the door and express your milk.
For many years, we did not have specific data about how lactation support programs paid off. Now we understand, because of programs like PGE, that when employers invest $1, they receive a return on investment of $3, which is a significant return considering the simple amount that needs to really be invested for the program to work.
So my pregnancy was very difficult, and I felt like I did not do a very good job during my pregnancy of supporting my child or my family. So it was really important for me coming back to work to know that I could continue to support my family, feed my daughter successfully, buy a new house for our expanding family, and more importantly, know that PGE was behind me in all of these activities, supporting me, and my job was secure. So this is a picture of my daughter, and here at PGE they allow us to put up a picture of our child, which helps with the pumping. And this is the original picture that I had hanging when my daughter was born. And then this is my daughter now, 5 years later. All grown.
We started our breastfeeding program, when New Seasons started. I was pregnant with my first daughter, and so that was 12 years ago. I had my first daughter soon after New Seasons opened, and she still likes to be referred as the first New Seasons baby. It was probably around 2004 that we started putting policy into place so that people knew before they left on maternity leave what to expect when they came back. So we have a room that other people can use as well, but a breastfeeding mom that's going to be pumping at work or having their baby brought in has first priority.
There's this room upstairs that no one was really allowed to use for anything because that was Peggy's pumping room. It is, in fact, the pumping room for all of the mothers to use if they so choose, but I was the one that was pregnant at the time and that they knew were going to be using it. So I got my very own room.
We were able to work out a program with Nursing Mothers Council where we rent pumps from them. And then when a mom comes back to work, she can just purchase a kit that she uses for her own personal kit that's around $35 as opposed to a brand new pump, which can be easily $300, $400. So it's less of an investment for the mother. They also get to use a better pump, which is fantastic.
Do we all benefit from the healthier staff? Absolutely. No premium increases is a great example of that. We got to add to our benefits this year. We got to do a lot of great things because people are taking care of themselves, and that's, I think, the incentive to do it, or how to explain it, that shows the long-term sustainable effects of a wellness program, is that we get to do more for less money because we're using our dollars wisely and we're healthy. It's not, it's not completely altruistic because everyone gets a win, but all boats rise with the tide. And so, you know, the healthier we are, the more money that we can spend to do other things to make people healthier, and the more money we save, you know, the more money they save.